Live from the Heartland Mamas studios, this is the Heartland Mamas podcast. I'm your host, Heidi Henry. The Heartland Mamas podcast is available on all podcast platforms, YouTube, TikTok, and Facebook, and proudly part of the Demcast USA network. As of today, we only have 335 more days left to save the USA. 335 more days until the November 5th, 2024 election. So get out there and find something to do to help people win up and down the ticket. I wanted to talk today a little more off the cuff than normal. I wanted to talk about the state of healthcare in America. In 2019, I did a tour of what the Heartland Mamas have always referred to as the Great Red Divide, which is areas west of us heading towards California. I'm in Illinois, of course. So I toured healthcare systems in Iowa, Missouri, Nebraska, and Kansas. And there I discovered, because some of them did not take healthcare expansion under the ACA, that people would have to drive up to 2 hours to get to an emergency room or to a doctor's appointment. And if they wanted to deliver a baby, they scheduled an inducement. They were induced because it was too difficult to get to the hospital on time. So when I came back home and I talked with my podcast partner, I said, this is coming our way. And I had noticed since 2015 that we've lost 6 rural healthcare systems to the west of me. So in the northern part of Illinois, to the west and a little to the north and a little to the south, we've lost healthcare systems from Mendota to Streeter to LaSalle, Peru, Spring Valley, Sandwich. They close and they become these just huge ERs, and they get people stable and they either send them home to go to their doctor the next day, or they fly them very expensively via helicopter to a trauma center or surgical center. And that helicopter cost often comes back right onto the consumer. And this is because our hospital systems, our doctors, are now owned by private equity. Private equity is usually a front for an insurance company like Aetna or United Healthcare or even Blue Cross. And what happens is these firms are in business to make money off the misery of others. And that's why our healthcare premiums have gone up. That's why we've lost these rural healthcare systems. That's why when I go to the hospital, when I broke my knee last year, I waited in the emergency room for 4 hours just to find out I broke my knee. In fact, I was getting ready to politely just go home, and it was terrible. I was in a lot excruciating pain, and I just wanted to go home, put ice on it, go to bed. Anyway, it's really important that I share this with you because of what I experienced this past week with one of my friends. They had fallen and injured themselves very badly. And even though they had Medicare and a co-insurance, the local hospital system stabilized them and then got them to drive clear up to Rockford, or had to be driven clear to Rockford to have a 5-hour surgery, which then they just sent that person home from. So instead of keeping them overnight to be stable, to save money, they had to go up to Rockford, have the procedure, very lengthy procedure, a long day for everyone involved, the driver, the patient, the doctor, I'm sure, and then sent them home on a lot of pain medication. So instead of going to a closer hospital, they had to stay in system, meaning they needed to keep the money in that system instead of referring them to a closer healthcare system that they might not profit from. So this person came back home, was unable to care for themselves, and re-injured themselves, and had to be driven all the way back up to Rockford, could not go through a local emergency room to be stabilized again, only to be sent back home on more medication to fend for themselves. And I don't know anywhere else in the world, in a civilized nation, a first world nation like ours, that this happens. But when I did the tour of the Great Red Divide, I saw this as commonplace. This was part of life. If you were pregnant and going to deliver a baby, you scheduled when you would be induced, because you didn't dare go into labor, because you could have to drive 2 hours to a labor and delivery center. Right? So you would schedule your time to have your baby delivered, and you'd go out there, Tuesday morning at 5 o'clock in the morning, and they'd induce you, and then your baby would be born. And that's not how healthcare is supposed to work. Out here, when you get shipped via helicopter to a trauma center, it can cost up to $10,000 right out of your pocket. And we have to mitigate these costs for people, because people end up in bankruptcy because they had a helicopter ride because there's no hospital systems close by. Now, where I live, and just to the east of me, there are more options within driving distance, very close. It's a different hospital system than the one to the west of me. Perhaps that's the issue. I'm not sure. But I do know that this creates huge hazards for people who are struggling through a medical condition, either through an accident, injury, work-related injury. It's impossible to get them stable and take care of them out here. Like if they can get to a local emergency center or a smaller hospital, they'll stabilize them, but they're not going to do the procedure there. They're going to ship you off, and you get what you get. I know, because, having done the math over the years and having studied this issue, that if we went from purchasing health care, I pay over $1,100 a month for my health care. I'm not old enough to be on Medicare yet, so I purchase my health care every month. I'm not a real big health care user. Last year, breaking my knee, I did use a lot of health care, but I don't normally, knock on wood, require health care to any huge extent. But I know that if I was in a public option, okay, like the VA has, where they have their own funded medical centers and so on. If I was in Medicare, I would have a lot lower premium each month. And you know what? By up to 2/3, that's a lot of money for a lot of households. But here we are. I've got, $1,100 every month in premiums. Plus I have a copay. Plus I have a yearly deductible. And then in January, that resets all over again. And I'm not even sure I met my deductible for this year. But all I do is pay. Same as you. Now, we need to get our act together as a country. This is a federal level, although some states have tried to solve this on a state-by-state level to offer a public option for healthcare. And I had suggested this years ago that we should have a public option here in Illinois. But Illinois supports the funding is just not right. And at the time that I was suggesting it, we hadn't gotten our act together financially. We've done so much better lately with that. The last few years under Governor Pritzker, we've really improved our financial stability here in Illinois. So, but what I'm saying is that we need to take a look at this, because I would be paying roughly 1/3 of what I pay for my health care. And we should have better things. We should have better health care. I have a friend of mine that just moved to Portugal because for $2,000 a month, she gets, her house, her food, her car, her health care. She has money left over to travel quite a bit, and that's what she does. She's like, it's so much cheaper to live in Portugal. And you know what? None of her ancestors were from Portugal. She's got no relationship to it except that it's beautiful there. It is just absolutely beautiful. I have another friend of mine that's moving to Croatia for the same reason. A lot of people move to Mexico and to Central and South America for the same reason. Why can't we do it as well? There's such a boogeyman involved with who pays for the health care, right? We're still paying for it, whether we pay a tax to have a public option or we pay our healthcare premium. And if you could choose between paying, say, $1,200 a year and a month and $400 a month, wouldn't you take the $400 a month? Wouldn't that extra money really help you? That extra $800 a month help you? I know it would help me. So we are at a precipice here. Watching my friend go through this the last few days has been excruciating. I know I have different options in my own healthcare than this person does. And I don't understand why we have to devolve into the haves and have-nots for healthcare. I don't understand that at all. We need to and must do better. Saddling people with these ridiculous helicopter trips for healthcare is horribly expensive, and they end up in bankruptcy court. it's still the leading cause of bankruptcy here in the United States is our healthcare system. So we're not doing things right. By giving over control to private equity, we are not taking care of our people. And we need to change that on a federal level. And I realize all the states down south that didn't take Medicaid expansion are going to freak out about it. But it's past time. They have to put the benefit and welfare and well-being of the people ahead of political ideology, ahead of corporate profits. I don't know that they can do that, but I sure wish they would, because this person really suffered for the fact that private equity owns our healthcare systems. Anyway, from the edge of the Great Red Divide, this is Heidi Henry, and this has been the Heartland Mamas podcast. I hope you have a good and very healthy day and year to come.